Today, trials of an early detection dementia iPad test begin in the UK. The app will be made available to tens of thousands of seniors at select hospitals and doctors' offices across the country. Michael Hurt is a dementia care manager responsible for rolling out the new system.
This isn't diagnostic, it's identifying that there is a potential problem, and it's saying that we want to investigate this further, and that's the role of the memory clinic. So they're the professionals that will do the diagnosing, and if there is a dementia, they will diagnose that and pass on that diagnosis to the person.
At this end are people whose memory is not good for their
Hayes thinks
age.
she has memory loss, but her doctor won't participate in the trial, so she went to see a different doctor who administered the iPad test.
I cannot do womanly things like fastening underwear. I have to have help with it. I cannot put washing out. I have to have help with it. Osteo and rheumatoid arthritis have consumed my life, but not my mind. So I want to keep my mind active, and the anxiety is coming because I think I have memory loss.
The test, called CANTAB, claims to be accurate in detecting the early signs of Alzheimer's disease using simple words and patterns on a touchscreen. Creators say the system could easily be reproduced into several other languages.
There is a general strategy, which I think the government have announced, to try and diagnose dementia earlier. The idea being that if it is picked up early, then support can be put in place if appropriate to try and keep people living at home in their own environment, or possibly avoid admissions to hospital.
One Cambridge University dementia expert is concerned the iPad test doesn't do enough to ensure patients are well cared for.
Push for screening when you know you have a good test, when you know enough of the disease to understand at what point you want to screen, and when you have a treatment or system that can take the influx of people.
The British government says that more than 500,000 people live with dementia, a number that may triple in the next 30 years. In 2009, it announced an initiative that called for improvements and early diagnosis in dementia care. Ross Simpson, The Associated Press.